Good afternoon. Alberta's government is always committed to telling Albertans the plain truth about COVID-19 and to following the evidence as we help to protect both lives and livelihoods. This approach has served Albertans well. Alberta created the best testing and contact tracing programs in Canada throughout the pandemic. We were the first province to roll out an online self-assessment tool and a wireless contact tracing application. We were the best prepared by far in terms of personal protective and medical equipment. Our medical professionals have done a phenomenal job of responding. We've put measures in place to protect our most vulnerable and supported Albertans as they work to reopen businesses safely. And we did all this while maintaining some of the least stringent public health restrictions in the country, and until the past few weeks, some of the lowest COVID numbers. But to be blunt, all that we have accomplished together is now at risk. Yesterday, we identified 802 new cases of COVID-19, and today we've identified 609 more. We also continue to see growing hospitalization and ICU admissions. As of today, there are 171 people in hospital, including 33 admitted to ICU. I know some people look at those numbers and they say that's a small fraction of our overall healthcare capacity, and they're right. But Albertans need to understand that these numbers are set to grow with the growing case count. And as we've had to change hospital protocols with more folks in self-isolation, as we've learned to prevent how to prevent spread within hospitals, and we're facing other challenges, we must take this very seriously, because if these numbers continue to grow at their current pace, they will put our healthcare system at risk. They will put our economy at risk and our loved ones at risk. Every Albertan needs to be concerned about these numbers. We've seen how hospitals get overrun in other jurisdictions around the world. We must not let that happen here in Alberta. This is a turning point. If we don't bend the curve down now, we'll face even tougher choices in the days ahead. But if we take smart, targeted actions and each do our part, we can continue to protect people's lives and livelihoods. As Dr. Hinshaw has said, we should not be afraid of COVID-19, but we must respect it. And it's time for us all to up our game. Our Chief Medical Officer and health officials have been closely investigating the spread of the virus, especially in Edmonton and Calgary, but right across the province. We've seen other jurisdictions implement sweeping lockdowns, indiscriminately violating people's rights and destroying livelihoods. Nobody wants that to happen here in Alberta. Alberta's government will always follow the evidence and the data based on the advice of our public health experts. The truth is that COVID-19 is being spread in part by at parties, through get-togethers and other gatherings with friends, neighbors, and extended family. We're all human, and socializing is an essential part of life. But we also have to make sure that we're socializing in the safest way possible. That's what we did this past summer. Folks went to parks instead of house parties, and we kept our cohorts or groups small and stayed home when sick. We need to do that again. For example, we are not seeing widespread transmission in restaurants. In fact, fewer than 1% of active cases in Edmonton and Calgary are linked to exposure in restaurants. That's because operators and staff have worked extremely hard to adopt the health guidance and protect the health of customers, and I want to thank them all for that. Our data indicates that it's currently safer to eat out at a restaurant at a table with no more than 6 with protections in place than to attend a private gathering at someone's home. In fact, so far in November, we see about 7% of traceable cases linked to social gatherings. We are seeing that informal social gatherings with families and friends are a major driver in spreading COVID-19. And currently about 40% of active cases in the 2 big cities are linked to household transmission or a private event. And so, acting on Dr. Hinshaw's recommendations, Alberta is taking smart steps to reduce the spread. On October 8th and 26th, we implemented targeted measures to help reduce transmission and slow the rise of cases in Edmonton and Calgary. Although we did see a slowing of case growth with some of the early voluntary measures, including here in Edmonton, it hasn't been enough to bend the curve down to where we need it to be. Cases keep rising, and these voluntary measures are simply no longer enough. The number of lab tests that come back is positive now at over 5% in North and South Zone and over 6% in Edmonton and Calgary. This is a very big increase from the 1 to 2% that we experienced through most of the summer into the early fall. No part of the province is safe from COVID-19. As of November 4th, we have 46 municipalities and 31 local geographic areas on a watch status. This includes 29 municipalities with more than 100 active cases per 100,000, twice the limit for triggering watch status. Worst of all, rising cases have now started to threaten our health system, as I've said. Hospital admissions are still at a record high in Edmonton, and they are rising in Calgary. With increasing new cases, we anticipate hospitalizations will keep growing in the next week or 10 days, with as many as 293 cases in hospital within the next few weeks if action isn't taken. This will impact everyone. It strains our healthcare system. Do not just challenge our ability to support those with COVID-19, but our ability to conduct scheduled surgeries and deliver care for other health issues that Albertans that we may have. And I want to make this point for folks who still think that we can just ignore the COVID challenge. The reality is that right now we are having to postpone and cancel non-essential surgeries, which means anxiety, suffering, and perhaps declining health conditions for Albertans. It also means that we have to move more and more people out of acute care beds who are receiving medical treatment. This is not a potential future reality, it is today's reality. And only more surgeries will have to be postponed and more people moved out of hospitals who are currently receiving medical treatment to make space for increasing COVID admissions if we don't get on top of this. So if you know somebody who's waiting for health care, somebody who's in a hospital or might need hospital care, this affects you, it affects all of us. But if we all do our part, we can help get these trends under control before we move into the Christmas season. So effective immediately, we are asking everyone in Edmonton and Calgary to stop holding social gatherings at home. These gatherings are the largest identified drivers of spread, often because people relax their guard at home. It's easier to mix and interact, of course, without the strict measures in place that exist in restaurants or other settings. Now just is not the time to host parties or large extended family dinners. Until cases slow, we must press pause on hosting any gatherings involving people outside your core family or immediate household. I'm confident that Edmontonians and Calgarians will heed this call. And I know this is an annoyance, and it's a sacrifice. And a lot of people will say the government has no business telling us who we host at home or what kind of socializing we do. I understand that reaction. But here's the reality. If we don't take these kinds of simple measures and make these sorts of modest sacrifices to social life, the cases will continue to grow to a point where they may grow out of control, and where the only options we have will be far more impactful on people's lives and livelihoods. But if we act swiftly and work together, this temporary step can and will bring our numbers down. And once that happens, we can ease this measure. COVID-19 is not just a problem in the two big cities. We're also seeing rate increases in other communities, especially many of the ones surrounding the two metropolitan areas. Some people are even beginning to move their social gatherings to surrounding communities to avoid the 15-person event limit. As anyone can see from our COVID-19 relaunch map, rising numbers are not limited to the immediate area around the big cities. Other parts of the province have seen concerning increases in numbers as well. And so effective immediately, Alberta is expanding the mandatory 15-person limit on social gatherings to include all communities that are on the watch list. This includes the majority of communities surrounding Edmonton and Calgary, and it means no large parties, no extended family gatherings, and no banquets or receptions with more than 15 people. We're also expanding the voluntary measures that are currently in place in Calgary and Edmonton. They will now apply to all communities that are currently on watch status and are blue on the online COVID map. Along with the mandatory 15-person limit, we're now strongly recommending that anyone in those communities limit personal cohorts to 3 or less. Reducing the number of people that you interact with by even 1/4, by 25%, would make a huge difference in our success. If you can reduce the number of people you see in person, please do so. See 2 friends in person rather than 3. Hold online or telephone meetings instead of in-person meetings where you can. Only play on one sports team or cut down the number of pickup games you participate in. The more each Albertan does her or his part, the more that you can help to bend the curve down and help to protect our healthcare system. Remember, the people you work with are not part of your personal cohorts. And this is why we're also strongly recommending that Albertans wear a mask in all indoor work settings, except when alone in a workspace like an office or cubicle where you're safely distanced from others or an appropriate barrier is in place. We're asking Albertans to do the right thing and adopt these daily actions to minimize transmission and to save the healthcare system from being overwhelmed. Alberta's government is also taking additional measures to bolster our public health response. Right now, AHS has more than 800 staff on its contact tracing team. We started with just 50 in the spring. Those 800 folks include full-time, part-time, redeployed, or casual staff. And AHS is prioritizing the hiring of approximately 380 additional staff as quickly as possible, bringing us to more than 1,100 projected contact tracing staff. As another step to support our hard-working contact tracers, we're asking all Albertans to download Alberta's contact tracing app, AB Trace Together. In May, we launched the first and still the only contact tracing app in Canada. At the time of launch, there were some technical challenges, but I'm pleased to say that those have been completely addressed. AB Trace Together is also directly integrated into Alberta's contact tracing system, unlike the federal app, making it a much more effective tool for reducing the spread of COVID-19. Alberta will not currently adopt the federal COVID alert app because a condition of doing so would be turning off the Alberta Trace Together app, which is a key part of our contact tracing system. And we will not do so precisely because the federal app is not a contact tracing app. Now, this has nothing to do with one being federal or one being provincial. AB Trace Together is, from our view, simply a better and more effective public health tool. It enables health officials directly to engage with those at risk, ensure positive COVID-19 cases and their close contacts isolate, and work to identify anyone else who may be exposed quickly and efficiently. Alberta's app was updated in September, addressing the Information and Privacy Commissioner's concerns and allowing it to run in the background on all devices, including Apple products. So I strongly recommend that all Albertans do their part and download the app to help protect themselves and those around them. We have committed to being as transparent as possible with Albertans. As cases rise, so too does the need to communicate the spread that we are seeing as frequently as possible. And so we'll be shifting back to daily reporting of case numbers starting this weekend. I know we've been having some technical problems with the new platform for aggregating and reporting COVID data, which are being corrected. We are taking action and following the evidence to help reverse the trends that we are seeing. And the bottom line is this: we all must do our part. Our collective action is crucial to limiting the spread of the virus and keeping our schools and our economy safe and open. We can keep kids in school, we can keep businesses open, we can keep people employed, and we can preserve lives and livelihoods, but we must all make trade-offs, compromises, and sacrifices. There are no magic solutions to this pandemic, as we can see all across the world. There's just hard work, sacrifice, and common sense. We have the power to keep COVID-19 from threatening our health system and to overcome the challenges that lie ahead. We all have a personal responsibility as parents, friends, neighbors, co-workers, to follow the public health guidance in every area of our lives. The actions we take now can help us to further bend the curve before Christmas. It's on all of us to rise to the challenge as Alberta does best, and as we've always done so many times. We can continue to lead the way as the freest province in the country if we all do it together. And I'll now ask Dr. Hinshaw to provide her daily update.
Thank you, Premier, and good afternoon. Today, I will be providing a breakdown of cases for the last 2 days due to the technical issues that we encountered yesterday. We are still working to fix the problem. We are able to report on our current numbers, but we are still addressing issues with updating the online dashboard and status map. This is our top priority, and we have 6 different teams and more than 20 people working full-time on solving the technical issues. The challenge we are experiencing seems to be in the data pipeline that connects our analytics infrastructure to the frontline lab and data systems in Alberta Health Services. The frontline systems are all working well, so there is no risk that cases are not being identified or notified right now. We are able to get the high-level case numbers from these frontline data systems, but we need to fix that data pipeline to be able to get all the details into our analytics system to be able to produce our dashboards. We are working this weekend to address the problem, and we will update the dashboard on Monday. Over the weekend, we will provide daily case counts on Saturday and Sunday, as the Premier mentioned, to keep Albertans informed. I know that many people follow this information closely, and I appreciate your patience. As Premier Kenney mentioned, on November 4th, we identified 802 new cases. Yesterday, as you heard, we identified 609 additional new cases. Over the last 2 days, we have completed 26,483 tests. There are currently, as you heard, 171 people in hospital, including 33 admitted to the ICU. Both Calgary and Edmonton continue to see rising cases, and other parts of the province as well. Sadly, I must also report 8 additional deaths over the last 2 days. My heart goes out to all those mourning a loved one right now, knowing that there are unique challenges to grieving together during this difficult time. I am concerned about the rising case numbers, and as I have said before, the cases we are seeing in schools, in hospitals, and in continuing care facilities are largely a reflection of the transmission that is going on in our communities. This is why we are taking the steps that Premier announced today, and why it is crucial that we all take action. I know these measures will impact many people, and they are not taken lightly. For those whose wedding receptions, family gatherings, or birthday parties may be impacted, I'm sorry for the challenge this change will bring. It is critical, however, that we bring our numbers down to protect our health system and our communities. In addition to the measures just announced, I would ask all Albertans to look closely at their own lives and ways they can make themselves and others safer. If you can reduce your social circle, hold meetings or events virtually, or embrace new habits that will make those around you safer, now is the time to do it. It will take all of us working together and being as careful as possible to reverse this trend. But it is possible. It has been a challenging year, but one thing remains true. We are in this together, and we are strongest together. Thank you, and we will now be happy to answer any questions you may have.
Before we get started, I'd like to remind media on the line that we have a lot of you waiting in the queue, so please limit yourself to one question. Operator, can you please put through the first caller?
Yes, first question is Don Braid with the Calgary Herald. Go ahead, Don.
Don, are you there?
Don, your line is open. Please check if your phone is muted.
Okay,
Don, hello.
let's move on. Operator, can you please put through the next caller?
Sorry, I just turned up here. It's Don. Was that for Don Braid?
Go ahead,
Yes,
Don.
you're still connected, Don. Please go ahead.
Yeah, it's okay. I was hoping to ask the Premier a question, but I think he's gone.
No, he's here.
Well, yes, okay, I would ask him a question. It's not really pertinent. I'm sure lots of others are waiting in line. So look, I'll drop out a line because this is not a related question. So why don't we start the line again?
Okay.
Okay, our next question is Safe Kaiser with 660. Go ahead, Safe.
Yes, good afternoon. My question for the Premier as well. Now, Mr. Premier, I caught something a little bit concerning in the AG report there, hoping to get some clarification. When you were asked about, just to get some context, when you were asked about what a Biden presidency would mean to Alberta, Keystone XL, and the economy, you said that loan guarantees wouldn't go into effect until spring 2021, and none of that over $5 billion USD would actually be in jeopardy. But I'm reading in this AG report that it says those loan guarantees actually go into effect January 1st. So I was just hoping to get some clarification on that, please.
Sure. So, first of all, I understand that TC Energy is working on developing its lending syndicate for the project for next year to support construction in 2021. And there would be an initial portion drawn down to support the formation of that lending syndicate. But the financing supported by Alberta's loan guarantee would only proceed in tranches as construction proceeds. So there would only be we can get back to you with the exact number. It's a very small portion of the overall loan guarantee that would be triggered at the beginning of the year, but the balance would be held back to help to secure financing month by month as construction proceeds next year. And if I could just ask our staff to have perhaps somebody from finance to call 660 with the more technical information in response to that.
Operator, can you please put through the next caller?
Next is Tyler Dawson with the National Post. Go ahead, Tyler.
Hey, guys. I just wanted to know mainly the thing about not having family hold parties at their houses and stuff. Is that voluntary or is it a recommendation? And, you know, as a result of sort of what has been said today, is your communications plan still working?
Well, it's voluntary. This is a strong request that Albertans in Edmonton and Calgary stop holding social gatherings at their homes, that they just keep to their core family group at home, period. We're not going to be sending out police to monitor this. As much as what we've done, this is appealing to people to exercise personal and collective responsibility so that we can avoid having to use more stringent measures. And what we have seen is that about 40% of identified cases in the big cities are traced back to household transmission or social gatherings, many of those happening at homes, which are less structured gatherings or people are more relaxed. I think folks get together with family and friends. They just don't, generally they stop thinking about COVID and they don't imagine they're with people who might transmit, and people are not going to be sitting around their dining room table or their living room watching a movie, typically wearing masks and all the usual protocols and guidelines. So that's the challenge. And I don't. When you say, is this a communications failure, I think we've been very clear in our communications throughout this. While we are very concerned about the current direction of the pandemic in Alberta, we shouldn't forget that through most of the past 9 months, we've done actually very well as a province. I think that's to the credit of people. And this is, by the way, it's not about blaming people. This is us giving them the best advice we can right now about how we can bend the curve down from the very troublesome direction.
Operator, can you please put through the next caller?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, this is for both the Premier and Dr. Hinshaw. Cases have been going up the last few months. Personal responsibility and tough talk really don't seem to have worked. Why not impose a lockdown like the UK, Germany, and France and stamp the virus out? Now, we've been told that there needs to be a balance, but the virus is spreading in workplaces too. And for Dr. Hinshaw specifically, what formal and informal advice did you provide the Premier?
Well, what you describe as a lockdown, first of all, constitutes a massive invasion of the exercise of people's fundamental rights and a massive impact on their not only their personal liberties, but their ability to put food on the table, to sustain themselves financially. That has huge downstream effects. Look, so far this year, I mean, let's put this in perspective. While we have to take the COVID threat very seriously, it is currently projected to be the 11th most common cause of death in Alberta this year. To date, we've lost approximately 340 lives, sadly, to COVID-19. In a typical year, 16,000 to 17,000 people pass away in Alberta. And so currently, this represents a tiny proportion of the deaths in our province. Currently, the number of deaths amongst people over the age of 65 in Alberta, who of course are those most threatened by COVID-19, is below the 5-year average, but the number of deaths for people under the age of 65, who are much less affected by this disease, is significantly above the 5-year average. Much of that seems to be due to the significant increase in opioid-related deaths, much of which we believe is actually related indirectly to the COVID pandemic because, well, for a number of other causes. So we actually have more deaths this year from opioid overdoses than we do to COVID. And so we have to look at all of these things in context and balance them. And I think Alberta has demonstrated that we've done very well through most of the past 9 months. Now we are seeing a significant spike, as are most other jurisdictions across the Western world. And we're taking appropriate steps that take a minimal impairment approach to the exercise of people's constitutional rights and to their right to take care of their families and have financial security as well. I'm sorry, Doctor, I guess there was an invitation for you to answer that as well.
Thank you. Yes. So the question about my advice has always been based on the fact that I'm responsible not just for protecting Albertans from COVID-19, advice about that, but advice regarding the overall health of Albertans. And we know that some of the measures that other jurisdictions have taken, of course, slowed the spread of COVID-19, but can have other health impacts. And so the advice that I have provided has always been to consider both the impacts of COVID and the impacts of restrictions. And I remain committed to that overall health of Albertans in all the advice I provide. These are very difficult decisions. And of course, what is really critical is that we are doing everything we can to provide every opportunity for us to bend this curve down together before considering more aggressive restrictions and watching numbers very closely to determine if these measures are working, which of course is what these stepwise increments have been predicated on.
Operator, can you please put through the next caller?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi there. A question for the Premier. How do you think Albertans are doing so far when it comes to exercising that personal responsibility, when we know that so many people have been going to work, shopping, or attending parties, even when they're sick? And just a quick question to Dr. Hinshaw, if you could explain just how effective AB Trace Together will be when the contact tracing system has effectively been suspended for most people.
So on the first question, I think Albertans have done admirably well through most of the past long 9 months. And I don't think we should judge the kind of collective behavior of Albertans on the COVID challenge just based on the last few tough weeks. The reality is, and this goes back to Julia's question before yours, that even though we have generally had less stringent health restrictions than the rest of Canada and much of North America, until the last few weeks, our per capita rates of transmission, hospitalizations, ICU admissions, and COVID fatalities were significantly lower than, for example, Ontario, Quebec, all of the U.S. states, and almost all of the European countries. So I think that is a objective metric of how responsibly Albertans have acted. It is concerning that we see over 10% of cases traceable to people who have had COVID symptoms and have gone out into the public, gone to work, and gone to socialize. But I don't, so that is a real problem. And we will be, by the way, we are stepping up our efforts to communicate to folks when we notify them that they are positive, that that there is a sick leave pay available through the federal program and other social supports, so that nobody should feel compelled for financial reasons to return to work if they're symptomatic or positive. So that is a real serious concern. But what we see here is a small minority of people who are not following the advice. And I guess one call I would make to family members and friends, if you know someone who's symptomatic, please reach out to them. Please, I think a lot of people have just kind of just wished this away, would like to pretend it's not a threat to them. Please, everybody has a role to play, not in calling up the police and ratting people out, but just personally intervening on a friendly basis to say, hey, if you feel like you've got the cold, you should really go home and get tested. So that's what I would say. 90% plus of Albertans are doing their best. We can't expect everybody to perform 100% every single day, but it's that small minority, unfortunately, that that can really bend the curve in the wrong direction.
With respect to the AB Trace Together app, so I just want to reiterate how the app works and the current status of contact tracing. So every confirmed case in the province will get a phone call from a contact tracer, and there will be a conversation with that person to determine when they were infectious, if they've been in any high priority risk settings, such as continuing care hospitals or schools, if they attended a group event where there's a high potential for large spreading events. So that call still happens. If that person has AB Trace Together on their phone, then the contact tracer can ask if they have that app downloaded. If they do, there is a functionality that can be enabled on the app that when the contact tracer identifies that period of time when that individual was infectious, then that code could be activated to automatically notify all those people who were in close contact with them during their infectious period. So it actually can speed up that contact tracing because it can enable that notification to happen automatically and instantly after that point of interaction with the contact tracer.
Okay, the Premier has time for one more. Operator, can you please put through the next caller?
Next is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Premier and Dr. Hinshaw. This is a question for the Premier, but if Dr. Hinshaw wants to weigh in as well, the more the merrier. Every day that I've tuned in to these updates, there's been asked at least once, and sometimes oftentimes, why not impose a lockdown? So for the Premier, let's say right now you had a complete change of heart and you said, you know what, I'm going to close all the restaurants, all the bars, all the gyms right now, right today, this very moment. Would that really achieve the goal? Doing that, especially with the transmission rates you're talking about, would that achieve the goal you're trying to achieve? In other words, the reason you don't want to lock down again, is it a philosophical reason, or is it because it would not achieve the goal of bringing the cases down, or is it both?
No, it would not achieve our goal, because our goal is not to take COVID-19 to zero. Our goal is to keep the spread under control so it does not overwhelm the healthcare system without hammering our broader social, economic, mental, and physical health. So the goal is, if the goal was just single-mindedly to take the virus to zero, as some other jurisdictions have tried to do, then it's a pretty easy policy decision in a way. You just, impose maximum restrictions, lock everyone in their homes, stay-at-home orders, shut down every business, close the schools, and watch massive social and economic damage ripple through society. We have demonstrated through most of the past 9 months that we can live responsibly with COVID, with limited, targeted, smart, data-based measures that do not cause massive, widespread damage to the health of our society. We need to get back to that, which is where we were through most of March through October. That's our goal. We do not think it's realistic that the cost to people's lives and livelihoods of trying to go to zero until there's a vaccine, and we don't know when that would simply be unacceptable in our view. That's not a question of ideology. We're following data. We're following evidence. So people who are hounding us to shut down restaurants, why? Because they want to, quote, do something, when our data indicates that 0.7% of identifiable transmission has occurred in restaurants and similar businesses. So what we're doing today is we're focusing on an area of much more significant transmission in a much less structured environment, which is at-home social gatherings and social gatherings more generally. So our approach will continue to be informed by the data and by balancing the COVID concern with other broader social, economic, and health concerns. Having said that, I've been clear, Rick, from the get-go, that as much as I believe Albertans want to maintain what I call responsible freedom in all of this, if folks don't respond to the kind of voluntary measures we're calling on today in Calgary and Edmonton, no more at-home parties, for example, if they don't respond, we will have no choice but to bring in more stringent measures. I don't want to do that. And finally, let me just say, I'm sure people who call for, quotes, lockdowns are well-intentioned. But I would ask them to be compassionate for the people who are barely hanging on to the, for example, restaurateurs whose life savings are tied up in those businesses that are barely surviving today. I'll just focus on that industry. 15,000 restaurants in Alberta employing over 200,000 people, many of them people with modest incomes. And to say, you know, in sort of an excess of caution, even though it's not supported by the data, we're going to shut them all down as we go into the Christmas season. Usually they're the only season in which their best season of the year, without that being supported by the data. What happens to those folks when they lose their life savings, when they lose their jobs, when they lose their incomes? What happens to their mental and emotional health? So I would just say to those folks, we will continue to stick to our goal, and we just ask Albertans to help us do that so we can get back to where we were earlier in the year. And with that, I'm afraid I have to run, but I think, Doctor, maybe you could take a couple more questions? Okay, thank you.
Dr. Hinshaw can take 2 more questions. Operator, can you please put through the next caller?
Next is Janet French with CBC. Go ahead, Janet.
Hi there. I'm sorry, my question was for the Premier. So I don't have any for Dr. Hinshaw at this moment.
Okay, thanks, Janet. Operator, can you please put through the next caller?
Yes, next is Jeremy Thompson with CTV Edmonton. Go ahead, Jeremy.
No, I'm sorry. Same goes for me. I did have one quick question for you, Dr. Hinshaw. Perhaps I missed it, but would you be able to repeat today's case numbers?
Sure. So the numbers for the last 24 hours, so yesterday's new case count was 609 new cases yesterday. The day before was 802.
Thank you.
Operator, can you please put through the final caller?
Yes, the final caller is Robson Fletcher with CBC. Go ahead, Rob.
Hi, Dr. Hinshaw. I actually did have a question for you, so this works out well. Before the school reentry back in September, you were saying at that time that the best way to reduce the spread of the virus in schools was to keep case counts low in the community. Now, a couple months later, I've seen people in other jurisdictions, some researchers in different provinces and elsewhere in the world, looking more at schools as a potential driver of the recent surges that have been seen in other areas. So I'm wondering what your sense is of that in Alberta. How much are schools and the resumption of other activities for school-age kids driving the spread in the community as a whole now?
It's a really good question, and of course we have had a number of schools with exposures and a number of schools with outbreaks. A couple of weeks ago, I had asked the team to look of all the cases in school-aged children starting in September up to mid-October. What percentage of all of those cases in school-aged kids had been acquired in school, so were a result of school transmission? And it was just 6% of all of our school-aged cases that had an infection that had been acquired in school. And so while certainly we are seeing some in-school transmission, the vast majority of cases that we're seeing where we have an alert or an outbreak in a school, and I will remind people that that outbreak definition is very, very conservative. So it is only, an outbreak is called when there are just 2 cases that have been in the school while infectious, even if they weren't directly linked to each other. So at the moment, the evidence that we have doesn't indicate that schools are driving this increase in spread. It does seem like that increase in community spread, I'm sure there's many factors with the fall and cooler weather. People are spending more time indoors. There's less of those opportunities perhaps for socializing outside that we had in the summertime. And of course, there are other activities that start up in the fall. In addition to school, there's other recreational type activities that people are engaging in. So I do not see evidence in Alberta of schools driving that increase in community transmission. It does seem to be the reverse, with community transmission causing increased pressure in schools and more cases, unfortunately, showing up at school while infectious.
Okay, that concludes today's Q&A. Dr. Hinshaw will be back with another update on Monday afternoon. Thanks very much.